everything together by first talking about the gaps in the literature. When we take a look at the research that is available on crystal therapy, it is crystal clear that there is not enough research done to support its effectiveness. The studies that were conducted, however, did not yield significant results, and the studies had one thing in common: small sample sizes. So why do people still turn to crystal therapy, and why is its popularity increasing? Well, perhaps it could be because of the placebo effect. Research available to us suggests that crystal therapy works predominantly under the power of suggestibility. One prime example we discussed were patients who were given both a real crystal and a synthetically identical crystal and were unable to tell the difference between the two. Finally, the third major criticism of crystal therapy is the amount of access to evidence-based research. There is very little studied under controlled conditions, but plenty of unvalidated literature originating from blogs, personal testimonials, ancient books, and self-proclaimed specialists in crystal therapy. We must ask ourselves, is it evidence-based or is it quackery? Well, it is not one product does it all. Sometimes it's a quick fix, but no, it's not a miracle cure, and there are no conspiracy theories either. However, it is all natural, and there are many personal testimonies that advocate for success. But in the end, we do conclude as a group that it is quackery.
So for the activity portion, we intended on bringing in a variety of crystals that we purchased on Amazon. And these included tiger's eye, amethyst, rose, and clear quartz, amongst others. So we wanted everyone to refer back to the lecture slides, to refresh on the stone's properties, and then everyone would have had the opportunity to choose which crystal they wanted to meditate with that would help them balance out any stresses or problems they were currently dealing with. For example, I would have chosen the amethyst stone because I'm trying to manifest good grades this exam season. And then we intended to run about a 3-minute meditation session with the crystals, and we wanted to wrap it up by discussing how to charge the crystals. So in order to charge them, they would have to be placed in a stream of direct sunlight or moonlight every 2 to 4 days. And then everyone would have had the opportunity to keep the crystals, take them home, and they would have been encouraged to use them regularly. And then we intended to touch base again with the class on our final review session to see if anyone had any thoughts or feelings about crystal therapy after having tried it for a few weeks.
Lastly, we also put together a little quiz for you guys to test your knowledge. You can find the quiz at this link provided below. The last segment of our presentation will involve discussion questions. Firstly, crystal therapy has been around for millennials. However, it has no scientific basis. Why do you think this form of healing continues to gain attention and popularity, even though the effect is attributed purely to the placebo effect? As we discussed in class, not all therapies can be summed up and evaluated using the golden standard research method. However, an understanding of cultural and contextual factors that play a role in crystal healing is more essential to understanding crystal therapy. Different ways of knowing also have a role to play in this. So even though empirical knowing isn't a strong look at this therapy, in terms of ethical knowing, aesthetic knowing, and personal knowing, we can better understand the effects of crystal therapy. And as with all CAME therapies, crystal therapy is more appealing because you have more time with the practitioner, there are no side effects, and it's natural and holistic. So taking a look at the role of spirituality, it connects us with a higher consciousness. It's related to religious practices, and it's linked to meditation, and it's proven to be effective in that sense. So in turn, I ask you, do you think that if crystal therapy garnered greater scientific evidence, that it could have a potential future in Western medicine? So we do think that it is possible. There are limited research studies on crystal therapy, so based on this, we can't come up with a solid conclusion. However, it is a holistic form of treatment and can be used as a complementary therapy. Currently, we've also seen an increase in the use of gem essence in skincare products. This indicates that there may be an effect after all. So, I would like to thank you for tuning into our presentation. If you would like to read more, please check out our references where we have tons of sources, and we do implore you to take a look at crystal therapy.